Hello, my name's Rob Webster. I'm the lead for the West Yorkshire and Harrogate Health and Care Partnership. I'm also a local trust chief executive. Our partnership is joining up care around the needs of people across West Yorkshire and Harrogate. We need to look at the mental, physical and social needs of people. That's because the population is changing and their needs are changing. Only by responding together can we meet those needs. Just to give you a few facts, about 70% of bed days in hospitals are now taken up by older people. We know that 1 in 4 people across West Yorkshire and Harrogate has 2 or more long-term conditions that they're living with. And we also know that over half of GP consultations are for people with a long-term condition. A few years ago, about 10 years ago, 1 in 10 people who were admitted as an emergency over 65 had 5 or more things wrong with them. Today, that figure's 1 in 3. So I could keep bombarding you with these facts forever, but the truth is the population's changed and we now need to join up care to better meet their needs. The good news is that services are changing to meet this demand now. Our partnership is already making a big difference. By working together, we can look at something that works in one place and share it with another. Already we're benefiting from having vanguard programmes in care homes that are seeing significant reductions in people transferred to hospitals after a fall, that are keeping people well so fewer people go to hospital in the first place, and that are providing care that's wrapped around the needs of the individual and keeps them well or manages them if they do become ill in their care home. This is good because we know that vulnerable people in care homes can become sicker quicker and can end up in hospital. And when they do, it can be difficult for them to be discharged appropriately to the right setting. These delayed transfers of care, or detox, are something that affect people right across the system. And there are multiple reasons why they happen. That's why it's good that we've been able to pick up good practice from different places to make sure that we're reducing them. And in September this year, there was a significant reduction in the days that were lost to the NHS and to individuals by being delayed in hospital. About 500 fewer days in a single month compared to the year before. That's really good for the system, that's 500 beds that are available, it's really good for the individuals, they're not in the wrong place, and it's really good for our bottom line. About £150,000 gets saved if we reduce bed days by 500. This has been achieved by working together because we are a partnership. It's been achieved because we can pick up on good things like matrons in Calderdale working in care homes, organising care around individuals. Because we can look at proactive discharge arrangements in Bradford through their team that's looking at enablement of people. And it's good news because we can look at good practice around sharing data and information across systems to plot what's really going on. Things are undoubtedly getting better. If you look at organisations and systems that have consistently been good, like Bradford, at things like delayed transfers of care, they're maintaining their position. And areas that have been less good, like Calderdale, which used to be in the bottom quintile nationally for delayed transfers, are improving significantly. Now they're consistently in the top quintile and sometimes have no delayed transfers of care. And what we know is that these issues are whole system issues. 60% of the time, it's down to the NHS that there's a delay. 40% of the time, it'll be a combination of the NHS, social care, housing, and other factors. So we have to work on it together. Our system's like a balloon. If you squeeze it in one place, it comes up as a pressure elsewhere. Unless you manage the whole thing together, you're not going to succeed. And the great news is, by bringing together councils, the NHS, charities, the third sector, and communities, we can look at the whole picture and we can start to make a significant difference. We'll need to in the run-up to winter because undoubtedly our resilience will be stretched and our services will be stretched. We'll have a much better chance of delivering if we all work together and if we build on the progress that we're making.